you hear me?
You are audible. You can
you
start.
hear? Okay. I'm speaking now. Can you hear me? I'm checking.
Yes, ma'am. You are clear.
All right. Okay. Good. Right. A very good morning, everyone in Nashik, India. Perhaps you are somewhere else, not in Nashik, but in India. Good morning to you. Here, 12 noon in Malaysia. So I hope everyone is fully awake. All right, and to listen to my 1 hour talk. I will try to make it interesting since I can see many of the students attending this talk. Right, before I start, I would like to thank Dr. Yogesh Ushir, the program chair of this ICTM conference, and SMBT Sevabhavi Trust, SMBT Institute of Diploma Pharmacy. Right, thank you very much for the kind invitation for me to speak today. Right, so let me share my screen. And please bear with me for 1 hour and then we can have some discussion, hopefully. All right, for this morning topic, as the title I put in the abstract is about the ancestral wound healing treatment in modern application. Right, for this ancestral wound healing treatment, actually the compound or the treatment that I'm referring to is the one that we always consume in our diet, which is honey. Right, so I hope it's going to be interesting talk. I'm going to share with you, first of all, about the history of honey, right? How honey is formed, just briefly, and different types of honey. And then we see how the roles of honey in wound healing. And then last but not least, but I will share with you guys recent findings from my research team before I conclude the talk for today. Okay, so honey actually it's used currently and also actually was used since a very long time ago. And if you can see on my slide here, the photo there is actually a rock painting. What is actually called as the Man of Bicop, which actually was found in Spider Cave in Valencia, Spain. Even though it was found in 1921, but the archaeologists believed that this painting actually existed since Paleolithic time. So it shows here that the human near to the beehive, and you can see all the bees surrounded him. So what actually this painting tried to show is, even though the man has to face the challenges to gather the honey, but they still try to get the honey as part of their diet. However, archaeologists couldn't find that time any evidence to show the use of honey for medicinal purposes. All right. Sorry, if the host can remove me from being the co-host, because like people keep popping out. I mean, I get the notification to allow people to enter the session. Okay, thank you. Right, so archaeologists after that found this painting, right? You can see on the wall. Okay, what it's trying to show here is actually to see they interpret this as a life cycle of the bee in honeycomb. So the uses of honey during this time, this is Neolithic era, because they found this in one shrine, Neolithic shrine at Kettelhuil, and they believe that honey during that era were used as a natural sweetener to treat the wounds, even back then, and they used the wax for painting, embalming bodies, as binder for ships and boats, and as well as for cosmetics. Right. And a few thousand years back, honey also was mentioned in mythology, in myth, Greek myth especially, and Egyptian myth. And if you want to go and read about the Greek mythology, they mentioned that about Zeus, that was hidden from his evil father and was raised only on milk and honey to make him strong. And then later on, he managed to take the throne from his evil father. And as for the in Egyptian mythology, honey was used actually as offering to the gods to show their devotion and worship. And in fact, archaeologists found jars of honey in the tombs of Pharaoh because they believe that honey can be sustenance for the next life. All right. So for formation of honey, we know like one big beehive, and we wonder what's going on there, how actually honey is formed. So basically, each beehive, they only have one queen bee, a special queen bee, which is actually the only female in that beehive that is sexually developed in the hive. And the main role of the queen is only to lay eggs after mating with the drones, right? So in one beehive, we have only one queen bee, and we have about 500 to 1,000 drones. And these drones is actually the male bees. And their purpose, the function of these drones is actually just to mate with the queen. And the worker bees, which is about 30,000 to 60,000 worker bees in one beehive, and they do all the job. They are actually the underdeveloped females, sexually underdeveloped females bee. So what they do everything else, okay, like collecting the nectar, caring for larvae, cleaning the nursery, and making wax for comb. So basically they have to go out and collect the nectar from the flowers, and later in the hive, they have to ingest. So basically they ingest the nectar, and then the nectar will be later digested and reach certain level of quality. So the nectar will be stored in the honeycomb, but because it contains a lot of water, high amount of water, so again, the drying process will take place and will be done again by the worker bees. And how they do it, they will fan their wings to assist evaporation of water. Only then the honeycomb will be sealed with wax in order to preserve the honey. So that's when we get the wax in the honey. All right, how about the composition of honey? Of course, it's sweet, so it must have some sugars in it. Right, the consistency of honey varies. Okay, first of all, it varies depending on the source of nectar, and this source of nectar actually varies depending on the flowers as well. So the main point here I want to highlight is actually, regardless of the sources of the nectar or the different types of flowers, but the major constituents of a honey remain constant. So meaning that every type or any type of honey, of course, they would have sugars, they will have proteins, vitamins, minerals, and this peroxide component, and as well as non-peroxide components. All right, as for sugars, all right, the carbohydrate this is the carbohydrate actually present the main carbohydrate, glucose and fructose. Okay, and but on top of glucose and fructose, they also have isomaltose, turanose, and maltulose. Okay, so basically it's a complex mixture of sugar. And this complex sugar, even though they are complex mixture of sugar, but they can be immediately digestible. Right, and they have various vitamins in honey, like vitamin B6, thiamine, vitamin C, folic acid, even they have. And as for the minerals, they have iron, magnesium, calcium, and also a few different amino acids such as proline and phenylalanine, which is very important as antioxidants. Right. As for the gluconic acid, actually is the product of the enzyme glucose oxidase and glucose itself. And the enzyme in honey, especially if later on we go to the stingless bee honey, is a little bit acidic. And actually all honey has also enzymes, right, which actually can be divided into two types, which are one originated from the worker bees. Remember just now I mentioned that the worker bee has to um, process the nectar that they collected. So the enzyme originating from hydropharyngeal gland of the worker honeybees, like invertase, glucose oxidase, amylase, catalase, and acid phosphatase. And for the enzyme originating from plants, okay, like catalase and acid phosphatase, and as well as small amount of amylase. And all these enzymes, especially glucose oxidase enzyme, is actually very important because it produces hydrogen peroxide, which not only help to preserve the honey, right, but also it has antibacterial activity. Right. As for the different types of honey, depending on the flower, and there are a lot more. If in Malaysia itself, we also have tualang honey, which is actually wild, the honey that we can get from the jungle. Many people do research on this tualang honey. But the one that I would like to share to you just on the acacia honey, manuka honey, and stainless bee honey. The reason why I'm sharing this, acacia honey, very well known, used in cosmetics field for cosmetics products because it has a very high activity as moisturizer. It's actually honey can act as what we call it a moisturizer because of its natural humectant properties. So it's contributed from the high content of glucose and fructose in honey. And how this glucose and fructose actually helps in the mechanism of giving hydration to the skin is actually this fructose and glucose can form hydrogen bridges with water to retain the moisture in the horny layer skin layers, and therefore can provide some hydration to the skin. And if you see manuka honey, right, is widely used and studied in for dermatology application. And in fact, if you go to the patent search, there are so many products for dermatology, and they use manuka honey. So you can go and read. This is one of the example of the studies done using manuka honey, but it's for me it's very established because for us here in Malaysia, we want to do research, we have to do something new. So that's when it comes to my interest, which is stingless bee honey. Right. I'm not sure in India if you have stingless bee honey, but for us here in Malaysia, is actually we can grow even stingless. We can have our own stingless bee farm because, as its name, is stingless. It doesn't sting. So this stingless bee honey, right? We can have standardized source. Basically, we can ensure that there will be less variation. If we use, say, wild honey like tualang honey, another local honey in Malaysia, then there will be some variations in terms of the composition of the honey. In terms of percentage, of course, the composition, namely like glucose, the enzyme, vitamins will be still there, the phenolic compounds and whatnot. But then in terms of the percentage of the composition varies depending on the source of the nectar. Right. So my research group, we do few studies, right? Few research using stingless bee honey, and one of it is for wound healing. Right. The reason why you can see here, right, or you can read our full paper. I put a name there. Is Jalil Kasmuri and myself, Hadi. Stingless bee honey, the natural wound healer, review paper. Before we started the project of using stingless bee honey into hydrogel for wound healing. So from the literature, it has been found and established that stingless bee honey has broad spectrum of antibacterial activity, and it has immunomodulatory characteristics. It's not just anti-inflammation, but it's immunomodulator, which is very good during the wound healing. which I will explain later. And also it contains a lot of high amount of phenolic compound, flavonoids and enzymes like glucose oxidase and catalase, which all these compounds associated with the antioxidant activity. So basically, this immunomodulatory, antibacterial, antioxidant activity, and as well as in general, honey as humectant, which can provide or act as moisturizer, all these criteria actually the roles of honey in wound healing and also very important to have during the wound healing process. So let's see the function or the roles of honey in wound healing. As I mentioned just now, honey is antioxidant, anti-inflammatory or immunomodulator, antimicrobial, and can be used as a moisturizer. Right. Honey as antioxidant. Okay, there are 4 stages altogether in the wound healing process, but I would like to bring your attention during the beginning of the wound healing. So when the wound just be induced to the skin, right? So when the hematosis and inflammation take place. So basically in the hemostasis stage, which is the beginning of the wound healing process, vasodilation take place, okay, around the wounded tissue, and overstimulation of vasodilation, right? Because the inducible nitric oxide synthase, which actually will lead to the production of hydrogen peroxide and other reactive oxygen species, ROS. Okay, so we do not want reactive oxygen species, ROS, because this accumulation of ROS will not only harm the wounded site, but if we leave it, it actually will spread to other organs in the body. So we want the antioxidant, and as I mentioned just now, honey has antioxidant activity, and there are studies and shows in Malaysia, the one team, the researchers from Margi is Malaysian Agricultural Research and Development Institute, a very big research institute in Malaysia. They identify these 2 compounds, PCA and 4-hydroxyphenylacetic acid. PCA protocatechoic acid, okay, and this PCA actually we can even buy from the market. It is very well known, very strong antioxidant, and stingless bee honey has very high concentration or high amount of PCA in stingless bee honey compared to other honey. So what a PCA does, because as a strong antioxidant, so PCA improves the cell proliferation in the wound healing process, and this 4-hydroxyphenylacetic acid can help to scavenge those reactive oxygen and nitrogen species. So it can be used as a good antioxidant, stingless bee honey. All right. And honey also can be used as antimicrobial, and the property as antimicrobial also critical or important in wound. Why? Because in any wounds, microorganisms already there, but they usually do not infect the wound, usually, and the wound also will heal. But this situation, okay, when there is no disturbance, okay, in terms of the equilibrium of the immune systems and the bioburden of the wound area. However, sometimes bioburden overcomes the balance, so they will impair the wound healing process. So once the impairment of the healing process take place, the bacteria will proliferate and occupy the host tissue. So this invasion, basically, of foreign bodies into wound will hinder or delay the healing process and can cause formation of granuloma or an abscess. So if you just leave it, okay, after a while, there will be another problem comes, okay, not just the wound, but like the leftover collagen produced, because it's going to be a very prolonged or long period of wound healing, then the patient will have keloid scars, okay, and it's difficult to remove keloid scars. There are a lot of other studies in the literature shows that stingless bee honey has the ability to inhibit both growth positive and gram negative bacteria. Okay, how this antibacterial or antimicrobial presence shows in honey is actually comes from two components of honey. Antioxidant just now, it's coming from the phenolic compound of honey. And as for the antimicrobial, it's coming from both peroxide and non-peroxide components of honey. So for the peroxide component is based on the activity of the hydrogen peroxide, H2O2, which actually regulated by two important enzymes, glucose oxidase and catalase. Right, so glucose oxidase actually induce the production of hydrogen peroxide, and the catalase destroy the hydrogen peroxide. So some balance in order to preserve the nutritional content of honey. And this hydrogen peroxide also will enhance the production of cytokines for the inflammatory response to kill the bacteria. As for the non-peroxide, are based on the phytochemicals, okay, high sugar content and the acidity of the stingless bee honey. If you can find stingless bee honey in India, you can compare the taste and even the smell. It has a bit strong smell, acidic smell to stingless bee honey. Right, so these phytochemical component in honey actually contribute to the effects, antibacterial effects like flavonoids, phenolic substance, of course, and also antibacterial peptides that present in honey. And these components it's by inhibit the phagocytosis, so it's prevent the superoxide free radicals from damaging the tissues. And about the acidity, because most of the bacteria, microbes, they like to grow in the neutral pH between 7.2 and 7.4. So this kind of microbes will be suppressed by stingless bee honey because they are more acidic in nature. All right, the next role of honey is anti-inflammatory or immunomodulator, right? Is actually contributed by the phenolic compounds. Okay, inflammation, okay, is a good response from our body when we get hurt, because it's actually is a protective effort by our body to remove any harmful agent and to start the healing process. Okay, and you can see here macrophages. Okay, I hope you can see my cursor. Macrophages here would start to encourage or increase the production of pro-inflammatory cytokines, the nitric oxide, and PGE2. And all these inflammation mediators actually highly cytotoxic and are involved in innate response by killing the target cells. So even though these mediators, okay, of course it has beneficial effects. That's why it's activated by macrophages to protect the body, but it actually can cause tissue damage, and this can lead to chronic diseases and also will impair the wound healing. So the introduction of anti-inflammatory, okay, or the properties of anti-inflammatory in honey can actually help to control overproduction of these cytokines or the inflammatory response. So it's not going to damage the skin cells and not going to delay the wound healing process. Right. So in earlier period, the emphasis of wound care management, okay, to have the wound area dry, to preserve the dryness around the wound. However, since 2003, okay, clinicians together with researchers, they agreed on new standard wound care strategy, whereby they want to have the wound area to be moist, not wet, but moist, which following the acronym of the concept of what they call it as TIME, tissue, infection or inflammation, moisture, and age, right? So why they want the moist area? Okay, it's not dry, it's not wet, but we have to keep the wound area moist. Basically, a moist surrounding is required to prevent secondary infection, one, and two, actually can create effective oxygen circulation. So because moist condition also can impede the desiccation and necrosis, can helps to enhance the formation of the blood vessels and connective tissues, as well as it can helps to rehydrate the dried out tissues. So application of moisturizer to the wound actually, okay, can also helps to reduce the possibilities of the appearance of scars. On the other hand, because we need to avoid the wound dryness, because dry environment actually can delay the migration of the epidermal cells, because as you know, the what we call it, the epidermal cells, especially the daughter cells, daughter skin cells from the stratum basal, the lowest layer of the epidermis layer, is going to take like 14 days, isn't it, to reach to the outermost layer of the skin. So it will delay the movement of the new cells. So we do not want to delay that. We want the new cells to form so that can repair the skin. So we want to provide the moist environment or the ideal environment for the skin cells to be generated. Right. And also the can reduce the scarring. Okay, so the high water content in stainless behind also can prevent the dehydration to the wound because of the osmotic effect that gradually delivers fluid to the wound tissue. So we can maintain the moist environment around the tissue, okay, accelerate the healing, and we can give a continuous moist condition, okay, but we have to be careful if keep giving the most, what we call it, hydration, the wounded area can be wet. However, with the application of honey, because honey has high osmolarity, so it's not going to wet the wounded area, but only can just provide or maintain the moist surrounding. Right. So since like I mentioned before that, even in Neolithic area, okay, honey has been used for the treatment of wound. The idea of the project actually, because when we see the clinical practice here in Malaysia, even the orthopedic surgeons or in the internal medicines, they use honey sometimes to treat the wound, but they usually sometimes they just use, or even the people, they just use honey and they put directly on the skin. So the application of honey on wound tissue like that, okay, is not going to be reliable, because the tissue will absorb the fluid, obviously, and also the dose of honey applied obviously not consistent. And as a pharmacist, we always looking into the dose consistency as well. And besides that, when we put honey, just imagine honey in our kitchen, we put on the skin, so we need something else to cover. So for those who are suffering really, like in the chronic wound patients, for example, in the diabetic foot patient, or like if you have large area of the wound, then you put honey, and obviously you will put some bandage or gauze to cover it, and then you have to open and do the dressing, and then put the honey again. And this application actually can cause non-compliance in patient, okay, not just we have the problems, dose inconsistency, but also patient non-compliance, because the patient may suffer from the pain during the dressing changes. So that's when we are thinking to use this ancestral wound healing treatment. We want to incorporate into a modern application or modern dosage form, which is hydrogel. Why hydrogel among all other dosage forms, like the gel, the normal gels, or the cream? Because hydrogel can, what we call it, can provide, give the texture of similar to the granulation tissue, and it's very cooling, provide a soothing effect, and can also helps to reduce the pain. All right. So let's share with everyone here the findings from my research teams. The project or the data that I presented here actually done by this gentleman here, Dr. Azri. He just recently graduated with a PhD from the group. Right. So when we started the formulation of honey hydrogel, because there are so many excipients that we can use to have hydrogel, and also there are a lot of optimization need to be done to ensure that we get a stable, right, and good release of honey from hydrogel. So we get some helps from design of expert is software, right? So now in my research teams, most of the formulation we use design of expert to help us to simulate and predict what are the factors that may actually influence the formulation. So we use for this particular hydrogel, okay, we use screening factors, two-level factorial designs, and then after that we use optimization of the formulation using the central composite design. Right. So the RSM by design of expert. Okay, so we identify or we put the 5 factors first. All right, and we decided from the literature to have PEG, agar, and glycerol, okay, as the factors influence the hydrogel, and as well as the temperature and cycles, because we use freeze and thawing method to produce this hydrogel. So how we prepare the hydrogel? Solution A actually containing water and polyvinyl alcohol. B containing the PEG, agar, and PEG, agar. Another one is the I cannot recall, glycerol. Okay, and then after that we mix these two solution, and we submerge in ultrasonic water bath to remove the bubble, degas it, and then we cool down the mixture to about 40 degrees, and then before we add honey. And then after about 45 minutes, we distributed those hydrogels in the Petri dish before we subject the formulation to the freeze thawing method. So basically we freeze the mixture for 18 hours at -20. And then after that, we take it out and put it at 25 degrees Celsius to thaw. So it's complete one cycle, 24 hours, and these cycles were repeated 3 times. All right, so for the response test, because we're using the design of experiment, DOE, so among all characterization, we use the swelling ratio as the response test to study the influence of the selected factors, just now the 5 factors, towards the formulation. Right, and from the analysis, we need to get the p-value less than 0.05 in order for us to conclude that that particular factor affecting the formulation. So as for my formulation, this hydrogel formulation, we found that the concentration or the amount of PEG, agar, and the cycles would contribute to the or affecting the formulation, the hydrogel formulation. Right, and Pareto chart also given by the DOE, right? So this actually to help us to understand further how those factors we said is affecting the formulation, but how it affects the formulation, whether it's going to give the positive effect or negative effect, it depends on the what we call it, the bar here. The orange bar here actually give the denotes, meaning it tells us is give the positive influence, and the blue bar give us the negative influence. So meaning that A is the PEG, polyethylene glycol, and E is the number of cycles. So basically PEG and number of cycles give positive influence to the swelling ratio of the hydrogel, and meanwhile agar give negative influence to the swelling ratio of the gel. Okay, So then we do the optimization of the formulation. Right, there are three factors just now, okay, the pack, agar, and the cycles. However, since the cycle during the, because we also have to do the concurrent preparation in the lab as well. So we fix the cycles to three cycles only, because of the, we cannot go beyond that because it will be too time consuming. So we only fix, so basically when we do the optimization, we fix the cycle and we try to do the optimization using the software by modulating the two factors only, PEG and agar. Right, so the system helped us and provided us with these 13 formulations. And using the swelling ratio as our reference, okay, for the characterization for the hydrogel. And if you remember Pareto chart just now, agar give the negative influence to the swelling ratio. So basically we can see that with the increased amount of agar in the formulation, it's actually reduced the swelling ratio. And on the other hand, since PEG influence according to the Pareto chart previously, so polyethylene glycol have positive impact on the swelling ratio. So we can see here that what we call it, the PEG, the increased amount of PEG in the formulation would increase the swelling ratio of the hydrogel prepared. So these are optimized formulation, then after that generated by the DOE. And so we concluded that we go for the full characterization of hydrogel using these formulations. Formulation 1 actually is the control without honey, and formulation 2, 3, 4 is with honey. Right. There are few other two, I think, yeah, antimicrobial testing, and a few more in vitro studies that I'm not putting here because I don't think I will have time to share everything. But these are the main characterizations that we did for the hydrogel that we formulated in the lab. So which is swelling ratio, WVT test or TR, gel fraction, rheological properties using rheometer, FDIR, release studies, and stability tests. All right, for swelling ratio from the figure, we can see that formulation 2, 3, 4, which is the, these are the formulations of hydrogel honey, has higher swelling capability than control formulation. So what does it tell us? It's actually shows the, it's measured the capacity of the hydrogels to absorb amount water, right? And then we also do the gel fraction. And generally for gel fraction is indicate high percentage of gel fraction is indicate strength of the gel. But then we, because as we know, high strength of gel will have reduced flexibility. So we would like to have some balance between the what we call it, the strength, gel strength, and also its flexibility, especially when you want to apply this on the, if you want to apply this on the chronic wound, right? Because we do not want it to be ruptured or to being too rigid, the hydrogel. All right. As for the water vapor transmission rate, okay, WVTR, we can see from the figure, okay, is no significant difference. Okay, the ideal hydrogel dressing actually to have good ability to control water loss and to maintain moisture. So we high WVTR actually can cause wound to dry more rapidly than normal and can lead to scar formation. So we want to have intermediate WVTR. Okay, so and comparing the formulation without honey, so WVTR of for the formulations containing honey is lower, even though it's not a significantly difference, but it's lower than hydrogel blank without honey. Right. As for the rheological properties, we measure the LVR which is the linear viscoelastic region, and through the oscillation stress strip test. So we want to see the what we call it, the shear rates for the stress strip test. Right, so we see here, okay, for the LVR, based on these rheological properties, okay, you can see formulation 3, okay, has the best rheological properties among others. Why I said it has the best properties among others, because it doesn't have the difference between the formulation 2, 3, and 4 is actually 3 doesn't have glycerol. And why I said it's good rheological properties compared to other formulations, because it has better and clearer this LVR line. All right, FDIR, okay, to see whether there is interaction between the honey and the excipients used in hydrogel. So for the, what we call it, the excipients compatibility or interaction, we can use, of course, FDIR, also DSC. We can see the thermal changes if we want to, but we didn't do it here. We do FDIR, okay, to see the fingerprint of the excipients or the formulations we have here. Right, the broad spectrum, if you can see here, the broad spectrum at the 3,200 to 3550 here is actually related to the hydroxyl stretching. Where's my cursor? Okay, hydroxyl is related to hydroxyl stretching, which indicate actually the presence of water. And this hydroxyl actually is the functional group of the polyvinyl alcohol, PVA, that we use, okay, in the mixture A just now. And actually, hydroxy group also present in PEG. So that's why we have this broad band from 3,200 to 3550. And then if you compare A, B, C, D, A is actually formulation without the honey. Okay, this hydroxyl group band, it doesn't change even with the, when we add the honey. So basically, there is no substantial interaction observed, okay, in comparison between the honey gel, honey hydrogel with the blind hydrogel. All right, so we have now honey in the hydrogel, but we also have to make sure that honey can leave the hydrogel and go to the site, the targeted site. So we did the in vitro drug release using total immersion method, and then for 24 hours, and we analyze using the UV spec. So what we observe is that the release of these of honey actually higher in the beginning and then slowly, okay, so because this is the cumulative release, right, the y-axis. So this actually, from the practical point of view for wound dressing, this sustained release is desirable, because in the early stage of the medicated hydrogel, the release should be rapid, right? The release should be rapid, and then followed by period of sustained release of the drug, so that the application of the drug on the wound will be sufficient. And then after 24 hours, just at 24 hours, we have a complete release of honey. So this is actually very useful and very practical, because we do not have to do the changes, because we can maintain the honey on the wound skin, the wounded skin, for 24 hours without changing the hydrogel as well. Excuse me. Right. So based on this characterization, and then also we do the stability studies, then we proceed further later to choose which types, which formulation is the best to try on the animal model. But before that, we subjected all the formulations to the stability studies. But since this hydrogel has to be kept in the refrigerator, basically, so about 4-5 degrees Celsius. So according to the Asian guideline on stability studies of drug, so we considered by storing the samples at 25 degrees Celsius with about 50 relative humidity for 3 months is considered as accelerated. But if the normal stability studies, this is the we call it real-time stability studies. But because hydrogel will be stored at the, in the refrigerator at 5 degrees, so this is considered as accelerated. So after 3 months of accelerated stability studies, we again characterize the swelling ratio and gel fraction properties if there are any significant changes. And fortunately, okay, there is no significant changes, slightly decrement, but still fall under the what we call it, the guideline. Still can be reported as stable. Right. So from the in vitro study just now, the relay study from the characterization, then we choose honey hydrogel formulation 3 as our product, right? And for the in vivo efficacy test, we use rabbits, and we have 3 groups, no treatment, and then 1 group we apply only hydrogel, exactly the same formulation but just without honey, and then another one honey hydrogel. Right, we use rabbit instead of rats because we want to reduce the number of animals sacrificed at the end of the study. So we use rabbits, and we do multiple incision actually on the rabbit's back to cover the 3 groups. Before this is actually our product just now. Let me go back. Here on the photo on the right here, the top right, this is the hydrogel that we have at the end of the formulation, and this is the one that we put on the in vivo studies on our rabbits, right? So what we did actually during the animal testing, we shaved the dorsal thoracic region of the rabbit, and then we gave IM injection of ketamine to anesthetize the rabbit, ketamine with xylazine, and then we cleaned and disinfected the area using 70% ethanol, so to make sure there is no introduction of the any bacteria or to prevent infection. Because then right after that we use biopsy punch and we cut the rabbit. So we make like about 4 mm diameter incision wound on the rabbit. So the wounding day itself, we consider it as day 0, and the wounds were categorized as no treatment, blank hydrogel, treated with blank hydrogel, and treated with honey hydrogel. And we treated the wounds OD, since the release study shows at 24 hours, the honey release from the hydrogel was 100%. And at the predetermined level intervals, we capture the wound image using the video scope probe of DermaLab combo. And then we measure the size of the wound closure. Right? Okay. At the end of the study, so we continue the studies and we keep observing, and then we notice day 9, okay, 1 group, the treated group is completely healed. So what we did after 9 days of treatment, we sacrificed the rabbits by carbon dioxide overdose, and then the wound tissues were extracted and we fixed them immediately with the formalin, and we subjected them to histopathological studies to observe the changes at the microscopic level to support the in vitro data. And we use the HNE, hematocillin and eosin, HNE stain, and as well as Mallory trichrome. And we also use normal skin tissues, and we stain them, also the normal skin tissues, with HNE and Mallory as baseline for comparison with the pathological changes on the wounded tissue. So we use what we call it different types of the HNE is the standard staining, and Mallory's trichrome stain, because we want to see to get clear visualization, because we cannot just simply repeat the experiment, so we just do these two stainings, because theoretically Mallory's trichrome stain should give us a clearer visualization of the collagen fibers, because collagen fibers production should be increased during the wound healing process. So both stainings we perform using the guideline. As for the HNE, we follow the Path Leica Microsystem USA, and for the Mallory's trichrome staining, we follow the protocol outlined by the Diapath Spa from Italy. Right. So we can see here the honey hydrogel groups, display significant increase in wound closure percentage, right? Even started from day 3, they are significantly different compared to the blank at the dark blue here, and this one is the untreated, right? And further, even to the day 6 to day 9, still they have the significant difference in terms of the percentage of wound closure. When we do the calculation in terms of the wound closure, and these supported by the histological assessment, right? I cannot compile all the 4 photos together. It's actually we have the normal tissue, normal no treatment, right? For the histological assessment, blank hydrogel as well as honey hydrogel. So, but I have to divide because otherwise I cannot really show the photos to you. So here as for the normal tissue, we can see the epidermis is relatively thinner, right, compared to no treatment group. Okay, the epidermis layer is thick. And another observation you can see is the presence of many skin appendages, right, can be observed in the normal tissue but not in the no treatment tissue, right. As for the blank hydrogel, again, you can see that the skin epidermis still thick, right, compared to the one treated with honey hydrogel. Okay, so to convince you further, I put side by side the normal tissue, okay, staining, HNE stain normal tissue compared to the honey hydrogel. So we can see here that the thickness of the epidermis is more or less the same. And to further support our finding, right, we also have proof in terms of the visual gross observation, where we use video scope image, which actually generated by the Dermalab combo cortex technology, a very useful method. We have different probes of Dermalab combo in our lab. So one of it, we can use the video scope probe to observe and capture this image to really see what's happening on the skin. So as you can see here, at day 9 for the hydrogel with honey, the wound completely closed and healed, and compared to the hydrogel alone, and of course no treatment, the rabbit suffered a little bit, right. So in conclusions, I can say that stainless bee honey-based hydrogel demonstrated promising healing properties, and the results suggested that stainless bee honey-based hydrogel can promote full thickness wound healing by promoting the wound contraction as well as collagen formation, and implies that introduction of stainless bee honey hydrogel provides synergistic effect to enhance the rate of wound healing, because when we compare the blank hydrogel versus the honey hydrogel. Okay. Right, so the output from this research project is actually we already filed the patent, still ongoing before it's granted. So the data is now already filed, and we also came out with 2 trademarks for the products. One product, Madu, is for the cosmetics application, and we have Hydrobi products is for the dermatology or pharmaceutical application. And of course, I need to acknowledge the funder for the project is Ministry of Education Malaysia, and endless support from the university. to help me to file the patent, get the trademark, and so on. And of course, I wouldn't have the data, even we have the funding, but I wouldn't have the data without the support of the work done by my team. This is my group, and we are at the Faculty of Pharmacy. Sometimes, actually, the photo here is from the progress meeting, and we had fun, of course, and this is birthday celebration. We work hard, we play hard, and where we are in Kuantan, Pahang, in a bit, not really far from KL. It's about 230 kilometers away from KL, or we can enjoy 2.5 hours driving from KL, or short flights, about 40 minutes flight only. You cannot even sleep during the flight, and we reach Kuantan from KL. All right, and here are some of the photos of my place. I would say very peaceful, beautiful city. This is not my hometown. I'm actually from East Coast of Malaysia. I'm from Kelantan, not from here, but I studied here 2003, 2007. So it's still the same, except they have more resorts here. And the new Starbucks are one of the prettiest Starbucks in Malaysia. All right, I think that's all. Thank you very much.